But now that we've got through fine motor skills, gross motor skills, and hand-eye coordination, I think it's a good time to discuss something called developmental coordination disorder and really dive into that, because it's one of those diagnoses that is out there, but it's not really talked about.
Absolutely. Goes by some different names as well. I'll let Keith jump into this one, I think, as well. We all talk about it as DCD, and sometimes you'll just hear it referred to as kind of, this is kind of old medical jargon, kind of the clumsiness diagnosis is older speak for it, but it's much more than that.
Yeah. And dyspraxia too, right? That's or apraxia. I think which all makes it a bit more confusing. But I was saying about like that type of those, like I'm having it right now, those sorts of challenges of me organizing my mind to be able to create the flow of a sentence is what these kids have challenges with as well, right? So the kid who's having trouble with handwriting, and then we're adding in the spelling, and then probably as you would say, he's also probably having trouble with the phonetics and really hearing and distinguishing through his sound of a B and a D, or any of the sounds that may sound similar. And then you're having that sort of sound dyspraxia, for a different way of putting it, and you're having this kind of dyspraxia, and then you're having dyspraxia of actually outputting the correct letter because you're trying to spell something, all mixed together, and the teacher's really just trying to assess the spelling through this specific means, right? You're able to create a symbol, and therefore I know you know how to spell this word. So developmental coordination disorder, I believe the symptoms have to have occurred before you're 5.
There needs to be persistent history throughout development.
And it used to be that you couldn't have both DCD as well as ASD. Like, so you couldn't be on the spectrum and have autism. I mean, have a developmental coordination disorder. And of course, all of us who worked with children on the spectrum knew that they all had these challenges. You're just calling it something else. And I think it's a really profound, huge concern that gets overlooked by many of the diagnosticians. So when they're explaining this to the parents, they don't really give enough information about the motor component and the motor challenges that they're going to experience. Because, just as we were talking about the handwriting, it's a profound way that we communicate, whether we're able to gesture. And that's all related to how you're able to have an idea and then have your body act upon it and be successful, for you to feel successful, as well as for it to have the communicative value or the actual action plan to get the movement to and force to get the task completed. Because these kids, it's not that they don't understand what you're trying to say. It's not that they don't understand that you want them to spell the word track on a spelling test. They're just having trouble getting their body to actually perform the action, which is very scary for them too. Like I think about it, and imagine if you knew what you wanted your body to do, and everyone's saying to you, just do it. It's this, and you're like, I get that, but nothing's happening. And I think there's a bit of almost like a lowercase PTSD that happens for these kids because they know that they can't do it. Because a lot of them talk about it when they're a bit older, about how anxiety provoking it was for them to have that experience. I mean, I've always been able to see it in their eyes. Like, you just like, oh my gosh, you know exactly, because I, repeated it 20 times when I was a younger therapist. I said, so they clearly don't understand what I'm asking them to do. And of course, we're all a bit more educated about it as well now, but explaining to like a brand new therapist or a parent what that looks like, it's like, no, that's what that is. And you in some ways, you just have to change the way that you're presenting the information or the activity to make it a little bit easier for them. And so using declarative language, using something that might provoke an automatic response is much easier than Alysha, stand up. Like, Alysha, I'm tired, I think I'm going to stand up. And then they're more likely to stand up.
Well, and I think something that would be easy to relate to. So if you're a gymnastics person, you follow gymnastics, you know all the moves, and you see Simone Biles do one of her tumbling lines, like, oh yeah, I can tell you exactly what that is. Okay, well now do it. No, I can't do that.
No, I can't.
Right? Exactly. Like, you may know exactly what the different hops and leaps and twists and pikes and everything are. You can describe them fully, but the actual action of doing it, or say if you're doing a beginner Latin dance class and you watch one of the, intermediate or advanced, and someone who's at that level can look at it and pick up the step right away. And it's something that you could do if you had the right practice and time, but you can't see it once and then do it. But then someone at that level who's like, oh yeah, I can do that.
Yeah.
Yeah. And that's some of those difficulties with kind of those adaptation skills and that kind of that fine tuning. And that's where tons of this frustration and anxieties come from too, because sometimes you'll be able to do something. Maybe I'm at the P&E and I can throw the ball at the target that one time, and it was, yeah, do that again. And deep down, I have absolutely no idea how I made that happen. And you telling me to do it again, just like how you did it, is paralyzing. And so that comes out with printing. Yeah, sometimes my A is what you call picture perfect, but it's really, really hard for me to do that over and over and over. And if I'm not doing it quite right, what are those kind of fine-tuning adjustments that will be helpful for me to stick it next time?
Yeah, and I think what kind of I find very challenging is that it often gets looked at as being a behavior and a defiance, and it's some sort of power struggle, because it's like he's just done it. I just saw my son do it independently, and now I asked him to do it and he refuses to do it, and I know he can do it because he just did it. And the kid's like, I don't even know how I made that happen. And then because like when you're demanding that somebody does something, it's just a different part of their brain than the automatic response part, as well as now you're asking me to do something exactly the same. And I've seen kids who know, like, they come back to the sensory gym the second week and they're like, I'm going to do that thing all over again, and they can't get it to happen. And because it was new, it was novel, they were able to just do it. And now because just the demand that they've placed on themselves causes them not to be able to do it. And it's quite I just go, oh, that happens to me too, and it does actually. but just saying those things that just takes some of the sting away and makes it more likely that they're going to try again, because the more that they do try, the better it'll get. And so you do want repetition, but you don't want them repeating exercises, because that may work for some of them, but it mostly you want them to repeat a motor plan. It doesn't necessarily, especially for the kids who are just kind of getting there in terms of being able to have those skills. And they have DCD, you just want them to try to, you find a way for them to jump up on top of the ball house as many times as they can, and make it fun, and not make it, you're going to do this 10 times on the ball house, because that, again, it just makes it you've just increased the amount of trouble that they're going to have performing this task.
Right, and correct me if I'm wrong, but I think it's important to highlight that because this isn't commonly talked about and known, a lot of GPs may not be familiar with it enough, and it may not be mentioned until a child is older. But then you have the, oh, well, they can play soccer or they can go skiing, but you have to think back on how those skills developed. And once you've practiced the skill over and over again, and you've had that desire to learn it, you may be able to learn it, yet still have something like DCD.
Yep.
Yep. And it affects, right, for some children, you might see the DCD come out more with fine motor skill challenges, and they're a strong, big mover, and other times it's flipped on their heads. Those gross movements are a lot more challenging for me than being able to kind of curl up in my happy place and do my precise work. It can be all of those differences. And absolutely, in terms of GPs and things, I think it's really, really important to do that advocacy work. And it's, DCD within BC especially is kind of gaining momentum and awareness, which is fantastic. And, that's starting to be something we can bring up in an IEP meeting, and the resource teacher might actually nod their head and say, oh, I know what that is. I wouldn't say that's the norm necessarily, but it's growing. And I can't understate the importance of recognizing it and the relationship with mental health and mental wellness for a child, and that it would be, a really, really deep misconception to think, well, this is just a motor coordination challenge, right? I don't think that plays a role in how that child participates in school, or I guess we'll talk about that during their physical education goals.
He'll grow out of it.
He'll grow out of it. Yeah.
Yeah.
It's much, much bigger than that. And, and there is lots of research that's going into things that are showing kind of the effects that are affecting social skills and, different mood disorders and anxieties and things that are the results of, a lifelong of difficulties with knowing what you want to do, but not being able to get your body to do it. And unfortunately, Keith's right, sometimes even being punished because you weren't doing what you were told to do, which is just devastating to think about. To be punished for something that you had absolutely no control over is just shattering.
Yes, of course.
I think this mom, I had an experience with a mom, and the baby was 2, and she was like doing things, and then all of a sudden she would like, trying to get her to do the same thing, even though she was having fun doing it. And you could see that especially when mom got really excited, that the baby would kind of try to do it, and then she'd get crushed because she couldn't do it again. And then I explained to mom what I didn't call it DCD, because I don't think the term was. It was always developmental dyspraxia was what we used. And so we were talking to her about what that meant, and that she has a clear idea, and she started crying. And I thought, oh, don't worry, she's going to be okay. Your child's going to be all right. We'll get her a lot further along than she is. She's going to be great. And the mom said, no, it was me. I realized that I had this when I was a kid, and everybody told me I was lazy. And the horrible thing is I believed them, and I'm not going to do that to my child. And I thought that tells you like everything that you need to know in a nutshell, because it just putting that for a young child to think of themselves as lazy, like, okay, I guess I'm lazy because I can't get my body to do something. And that would just make me want to give up. I mean, I think that's leading towards that, rather than somebody who says, well, I'm going to do it differently. And it may look different. It may feel different, but I'm going to do it and have fun. And those are the kids like that can do some soccer skills, because all of it becomes an automatic reactive response too. And the downhill skiers, it's like it's a reaction, and it's like this the ski hill is novel every time you go down it, because even if it's the same, if the snow is different that day, it's different. Like, whether it's harder or softer, and sometimes it's faster or slower, and so it's always has a novel, and it has a lot of good input coming out of it too.
Of course.